The pace of the vaccination will be determined by the availability of vaccines, and government has done its part to make sure that we have paid for all the vaccines that we require for the nations, but it's access to those vaccines that we have paid for that is limiting our ability to move faster. And we have ramped up, as the President has announced, the capacity from the Department of Health and including the private health partners of vaccinating. The number we're now sitting at 100,000 per day, which we can be ramping up to get to 300,000 per day, so that we can then improve the access and speed of vaccine. But that is also determined by whether we've got access to those life-saving vaccines. And recently there have been announcements about partnerships to manufacture vaccines in the country, and that work is ongoing to make sure that access to vaccines are done. But before we get those access to those vaccines that the government has duly procured and paid for, because there's an impression that government has not procured the vaccines and have not paid for the vaccines. Government has procured and paid for the vaccines to make sure that all South Africans who require the vaccines are vaccinated. Our best efforts is compliance with the regulations, compliance with the non-pharmaceutical measures of keeping safe distances, and also wearing masks in public, wearing masks correctly, and also sanitizing our hands and avoiding public places where it is necessary. There are implications for the adjusted level 4 for the workplaces to say what are we doing or what should be done to make sure that we comply. In the malls and shopping places, what should be done to make sure that we comply and save the importance of life. So today we are going to explain per sector that are affected directly on what are the compliance measures that are going to be done and how are those going to be enforced or ensure that there is compliance, and that's why the necessary ministers are accompanying us in this briefing. So before we take questions, we are going to invite the few ministers to make statements, and we'll start with Minister Nkosazana Dlamini Zuma, the Minister of COGTA, who's responsible overall for vaccination. She's joining us from the hybrid. Over to you, Dr. Dlamini Zuma. Is she being connected?
Thank you, Minister, and colleagues in Cabinet. On the 27th June 2021, the President announced that Cabinet decided to place the country on adjusted level 4, a measure aimed at arresting the third wave of the COVID-19 pandemic that is spreading like wildfire. Regulations published by the Minister of Cooperative Governance, which give effect to adjusted level 4, enjoins us to ensure that the transport sector is responsive to the tightening of measures to slow down the spread of the pandemic. Restricted hours of movement in terms of the amended regulations at 9 o'clock until 4 a.m. This means that public transport is not allowed during the curfew period, except for circumstances outlined in the regulations. On maritime transport, there will be no changes to the directions regulating the movement of ships. The ban on passenger vessels and cruise liners remain in place, and only vessels bringing in cargo are allowed to call on our ports. All commercial seaports will remain open, and small crafts are still allowed entry into seaports in line with all health and border law enforcement protocols. On aviation, restrictions on international air travel remain. International air travel is restricted to the following ports: OR Tambo International Airport, Kinshasa International Airport, Cape Town International Airport, Lanseria International Airport, and Kruger Mpumalanga International Airport. Exceptions on curfew for long-haul flight departures and landings remain. Long-haul flight departures and landings at the airports indicated earlier are permitted during hours of the curfew. Restrictions inside the cabin remain, and aircrafts must continue to comply with health protocols. On rail, there are no changes to the directions regulating rail movement. All rail operators must continuously update their COVID-19 management plans to accommodate a development risk of infections and challenges experienced in relation to COVID-19. Public transport. Restrictions on public transport loading capacity remain, being 70% loading capacity for long distance travel and 100% capacity for short distance travel. Interprovincial travel for leisure to and from Gauteng is prohibited in terms of the regulations. Interprovincial travel for leisure to and from Gauteng is prohibited in terms of the regulations. The transport sector must continue to comply with the health protocols and wearing of masks and provided in the public transport service directions. It is mandatory for any driver, owner, or operator of a public transport service not to allow any member of the public who is not wearing a face mask to board or be conveyed in public transport owned or operated by him or her. Cross-border road transport. There are no changes in respect of cross-border transport services directions. The 20 land borders which are fully operational will remain as such, and the 33 land borders which were closed will remain closed as per the amended regulations. Cross-border transport sector must continue to comply with the health protocols and wearing of masks as provided in the direction. Transportation of liquor. Transportation of liquor is prohibited except where alcohol is required for industries producing hand sanitizers, disinfectants, soap, alcohol for industrial use, and household cleaning products, as well as for export. We must continue to ensure strict adherence to health protocols and restrictions if we are to arrest the spread of this pandemic. I thank you.
Thank you, Minister. We'll try again the connection to Dr. Dlamini Zuma, if that connection is being able to be linked. There is no connection. Can we try the connection of Minister Thulas Nxesi? Then, because the connections are still a challenge, it's our first time doing a hybrid media interview. We'll invite General Kele to come and give the compliance measures from the police.
Thank you, Minister. The Program Director. Thanks, Minister Chola, Malula, and the ministers, other ministers, wherever they are. I would like to start my address by welcoming the President's pronouncement that the vaccination of SAPS and security personnel members will kick off on the 5th of July. The Police Ministry received a comprehensive briefing from the SAPS management on this matter. We are satisfied that inoculation of over 180,000 SAPS members and supporting staff will go ahead as planned. Sadly, COVID-19 has claimed the lives of 666 police officers. While we gear up for the vaccination of officers in the front line, we know that for the next 2 weeks, it will not be business as usual as we operate under Adjusted Alert Level 4. Over and above the national vaccination program that is underway, breaking the chain of transmission by reducing person-to-person contact remains a priority of the government if we are to flatten the curve. We are aware this approach will take adherence to the lockdown. Law enforcement officers will play a critical role in ensuring mass compliance of the Level 4 rules. Security forces will have their work out for them, cut out for themselves. I, however, want to assure the country that while law enforcement is up to the task, their aim is not to arrest and criminalize people in mass. As a country, we are all wiser to the effect of this deadly virus now. We all know the pain and destruction COVID-19 continues to cause for us as a nation. And I am confident there will be more compliance to the regulations set out to save lives than before. Ladies and gentlemen, those who chose to drop the ball and chose to transgress, they must know that police will be left with no choice but to act. For the next coming days, everyone who lives within the borders of the Republic of South Africa is expected to wear a mask at all times when in public. 2, observe the curfew that is in place from 9 to 4. 3, not to partake in any gathering, whether indoors or outdoors. 4, adhere to social distancing and health protocols when attending a funeral with 50 mourners or less. 5, night vigils after funeral gathering and after tears gathering are not allowed. 6, while you may still go to the beach and parks, there cannot be any gathering in those public places. 7, the transportation and sale of alcohol, both for on-site and off-site consumption, is prohibited. Non-compliance of these regulations and some others gazetted in the Disaster Management Act will result in a fine or imprisonment not exceeding 6 months or both. Since the 27th of March, unfortunately, 2020, 465,098 people have been charged with the contravention of the Disaster Management Act. And you must remember that now, from now on, all those people that will be charged there, they will be having criminal records. 7,439 of them were arrested during adjusted alert level 3, which commenced on the 16th of June 2021. Police will continue monitor compliance through targeted operations, which should be intensified in hotspots provinces. Committee members are also encouraged to continue to be instrumental in reporting the flouting of the regulations. I want to take this opportunity to remind the nation that reckless calls for mass contravention of the Disaster Management Act have no space in our society. If I want to emphasize this point, this has been done by some political leaders, but also some people from the business. I'm glad that there's been the change of heart on the call that was made when it comes to the people that trade in alcohol that they must defy. I will emphasize the retracting that call has been reversed, because really it will be bad for people that are defying. 14 days, as the president has said. If you defy, you might find yourself losing your stock, going in prison, losing your license, and you find that after 14 days, you are no more a trader. So we are happy that that kind of call, the sense has prevailed and it has been reversed. The president has warned us all the time that we shouldn't be complaining. Comes as a high price if complacency happens, that will come on a high price. Don't let your life and that of your loved ones be the price. Let us all play our part in flattening the curve. Rest assured that the police and all security forces are on hand and will continue to play their hands together with the community. The clarion call is that let's work together here. Please allow the police and refuse the police to act because you are complying. If you comply, definitely it will be easy for the police. But that does not mean that if you don't comply, you won't act. Thank you very much.
Thank you, Minister. Minister Dlamini Zuma is able to now join us. The technical feed has been sorted. Minister Dlamini Zuma, over to you. I understand they are able to hear us. It's us who's not able to hear them. Okay.
So I'm going to look at the movement of people. We have moved now the curfew from 10 o'clock to 9. So you have to be indoors between 9 at night, 2100 hours to 4 a.m., except if you have a permit. Otherwise, you have to be indoors. And this applies for 2 weeks. And under this gazetted level 4, the work is permitted in most industries. So the livelihoods are being protected whilst we're trying to save lives. So most people will be going to work because all the industries, except very few, will be operating. We are also stressing the issue of wearing of masks. It is mandatory for everyone to wear a mask in public, excluding children under 6 years old. We are also saying that the social gatherings are prohibited in cultural, political, faith-based, and gatherings in cinemas, theaters, gyms, galleries, museums, libraries, and many other places where people gather. And this is prohibited for the next 2 weeks. But hotels are open. And in fact, it should be that hotels should be open to 100% capacity. But the restaurants, including the restaurants in hotels, are not allowed for sit down, but only for takeaways. So hotels are open in terms of accommodation, but the restaurants are only open for takeaways, and the conferencing facilities are prohibited for now until the 11th. The only gatherings that are permitted are those.
Recording stopped.
Funerals.
Recording in progress.
And funerals are allowed only 50 mourners, and for 2 hours, not more than 2 hours. Night vigils and post-funeral events like after tears or after cremation gatherings are not permitted. They are prohibited. Even under this adjusted level 4, in order to protect lives and livelihoods, but at the same time, making sure the economy is still going, we are going to close, we are prohibiting the sale of alcohol, mainly because alcohol contributes to the crowding of hospitals because of accidents, stabbings, and all such activities that lead to emergencies in hospitals. So alcohol is prohibited, whether for on-site consumption or off-site consumption. But transportation is also prohibited, except for industries that are producing sanitizers, disinfectants, soaps, alcohol for industrial use, and household cleaning products. It will also be permitted for warehousing and storage purposes. We are also, the Minister of Education will also talk about schools whose closing date has been brought forward, but I will leave that to the Minister of Education to expand on. It is still very important to ensure that in the public buildings, those who manage those public buildings or own those public buildings make sure that people wear masks, that there is social distancing and sanitizing, including ATMs, because these non-pharmaceutical measures are still the best measures we have to protect ourselves from this pandemic. Of course, the Minister of Health will also be talking, the acting Minister of Health will also be talking about vaccinations and how people should make sure that at vaccination sites, the social distancing, the masking, and all the non-pharmaceutical measures are in place. So these are the measures. And then when it comes to interprovincial travel, traveling to Gauteng for leisure and traveling out of Gauteng for leisure is prohibited. People must only travel to Gauteng or from Gauteng for business, for commercial, for work, for cargo, for transporting goods, but not for leisure. Only those who are traveling for those purposes will be allowed. And this is because Gauteng is the epicenter of this wave 3. And as the epicenter, it connects with many provinces as our economic hub. So if people move in and out of Gauteng, it means the infections will spread much faster to all the other provinces. That's why the interprovincial travel to Gauteng is limited. I think for now, those are the issues. Maybe I'll just say a few words in Zulu to say that eGauteng umlilo mkhulu kakhulu uyabhebhetheka walesifo, kodwa kuzo zonke ezinye izifunda sikhona lesifo. Ukhona nale nhlobo entsha ivariant okuthiwa iDelta. Ngakho-ke izindlela zokusigwema zizoba kulo lonke izwe ngoba senzela ukuthi lawa izifunda ezingakafiki ezingeni laseGauteng zingafiki. Yiko-ke kufanele ukuthi senze konke ezweni lonke, singasho ukuthi ngoba eGauteng umlilo usumkhulu kakhulu senze eGauteng kuphela. Ngakho-ke kuthiwa kufanele wonke umuntu abesekhaya kusukela ngehora lesishagalolunye ebusuku kuya emahoreni 4 ekuseni. Wonke umuntu kufanele abesekhaya. Sonke kufanele sifake ifonyo njengoba sizifakile nje masiphuma, nabantu akuyibona ababhekele amabhilidi noma indawo zezitolo, ama-malls noma yini, fanele ukuthi benze isiqiniseko sokuthi wonke umuntu ongena lapho uyifakile imask, usifakile isifonyo, uyasanitizer, futhi abantu baqaqene. Kusabalekile ngoba ikona okuzosifikela kulesifo. Kodwa ke kunjalo sithi futhi abantu abahlala emakhaya bangayi emicimbini, imicimbi ivaliwe manje. Imicimbi yonke ivaliwe, okuvumelekile kuphela umncwabo. Umncwabo ube nabantu abama50 kuphela. Ungabi ngaphezulu kwamahora 2. Futhi akuvumelekile ukuthi kube khona umlindelo. Akuvumelekile ukuthi emva komncwabo abantu bahlangane benze lento kuthiwa ama-after tears noma yini. Kufanele abantu maqeda umncwabo bahlakazeke, kungabi khona ukuhlangana. Indawo zokungcebeleka eziningi zivaliwe, kodwa amahhotela wona avuliwe. Kodwa indawo zokudla ziyi-take away kuphela. Awukwazi ukufika uhlale phansi udle, nekuthatha uhambe. Noma ngabe usehhotela kuzoba njalo, mhlawumbe bazokulethela endlini, mhlawumbe uthathe uyodlela endlini. Kodwa ezinye indawo zivaliwe njengama-gym, nama-library, nama-theatre, zonke lezo ndawo ezinjalo, ama-casino, amasonto, imbuthano yezepolitiki, konke nje lokho akuvumelekile. Utshwala akuvumelekile ukuthi budayiswe noma butransportwe. Utshwala noma ngabe uzokuphuzela khona lapho la kuphuzwa khona akuvumelekile, buvaliwe. Noma ngabe uzokuthenga uyophuzela ekhaya akuvumelekile. Dayisa nje utshwala akuvumelekile. Kodwa ke lobo obuyiswa ngaphandle for export kona ke kuzohamba nale alcohol yokusanitize, yokwenza zonke lezo zinto izovumeleka ukuthi ihambe. Kodwa nje utshwala akuthengiswa nje kulamasonto amabili kuze kube mhla ka-11. eGauteng ngoba isifo sibhebhetheka kakhulu khona, akufuneki usuke nje uthi uyovakasha eGauteng noma uphume eGauteng uthi uvakashela kwamanye izifunda, ngoba uzothatha isifo eGauteng usise kuzo zonke izifunda. So akuvumelekile ukuya noma ukusuka eGauteng ngaphandle mawuhambela umsebenzi noma ibhizinisi. Nalaba bathutha izinto ngama-trucks nani bavumelekile labo. Kodwa nje ukuthi uvakashe nje uthi hayi ngikhumbule ngiya lapho, ngiye eGauteng noma hayi ngisuke eGauteng ngikhumbula ukuya e-Eastern Cape noma kuphi, akuvunyelekile kulamasonto amabili, ngoba kwenzela ukuthi isifo singagcwali ngokushesha kuwo wonke, kuzo zonke izifunda. Izikole, ungqongqoshe oqondene nezikole uzonaba ukuthi kuzokwenzekani ezikoleni, njengoba umongameli eshilo ukuthi kuzovalwa kusukela ngoLwesithathu. Kodwa ke ungqongqoshe uyena ozosho ukuthi kuzokwenzeka kanjani, nangendaba yokuthi inkantolo yathi ingane kufuneka still zikuthola ukudla ezikoleni, uzonaba ungqongqoshe asho ukuthi kuzokwenzeka kanjani lokho. Siyethemba ukuthi sonke sizozama ukuzivikela, ngoba akekho ophephile. Noma ngabe wake wayithola iCovid, usangaphinde uyithole manje futhi. So ungasho ukuthi mina sengingayithola sengi-right, usangaphinde uyithole. Sinifisela ukuthi niphephe, kodwa ukuphepha kwethu kusezandleni zethu ukuthi senze lokho okufanele. Ngiyabonga kakhulu. Ngibonge nakungqongqoshe osiphathele uhlelo.
Thank you. We'll now compliance with as it relates to the Department of Employment and Labor. And may we have him sticking to 5 minutes, please. Thank you, because we still have to do questions.
Thank you. Thank you to the convener of this press briefing, Minister Nchabe, the ministers, the deputy ministers and officials, members of the media, ladies and gentlemen. As a Department of Employment and Labor, since the start of this pandemic and during the lockdowns, our focus has been on the following areas. As a priority, tightening and enforcing the health and the safety measures in the workplace, keeping workers safe. Working through the UIF, that is the Unemployment Insurance Fund, to mobilize fund surpluses to provide income support to the laid-off workers, and working through NEDLEC, that's the National Economic Development and Labor Council, to facilitate the social dialogue and build a united response to the pandemic and the lockdown across the social partners, that's government, labor, business, and communities. On health and safety, our health and safety labor inspectors have worked with the NEDLEC to draft the directions and regulations in response to the new conditions of the pandemic, covering the PPEs, the masks, hygiene, and the redesign of the workplaces to increase the social distancing. Of course, regulations would not help if they are not enforced. Our inspectors were active during the pandemic, inspecting and enforcing and advocating and explaining the new regulations to the employers. Our statistics that these measures were successful, or indicate that these measures were successful, largely preventing the workplace outbreaks, and with the workplace infection rates well below the community infection rates. But we were also preparing for a long haul. During the 2021, the department employed and trained 500 additional new health and safety inspectors, and this will allow us to quadruple the number of the workplace inspections during the coming year, with the target of nearly 100,000 inspections. These measures became all the more necessary during the second wave of the pandemic, driven by the Beta variant as the pace of the infection increased. We have now entered the third wave of the pandemic, driven by this Delta variant. So the rate of infection has again greatly increased. But we have the regulatory regime and the capacity to inspect and enforce already in place to cope with the new challenges. Let's just remind ourselves that in making workplaces safer, we not only protect lives, we also protect livelihoods and economic activity, which allows us to continue to function as a society. This week, my department will finalize a rapid response plan to inspect workplaces across provinces for compliance with health and safety regulations. We are mobilizing other departments to work with us on this. So the labor inspectors have collected detailed statistics on non-compliance across the sectors, the areas and employers, and this includes the public sector, and I'm afraid to say. And this knowledge will inform the inspection plan. On a very positive note, let me also flag that the most recent health and safety direction agreed at NEDLEC include a plan with the support of labor and business to utilize workplaces in the rollout of the vaccines. On income support, during the pandemic, the UIF COVID-19 CARES benefit scheme has distributed 60 billion to over 500 million laid-off workers, supporting them, their families and businesses and communities across the country. And in response to the level 4 lockdown, the UIF management has been locked in discussions with the actuaries to find the surplus monies to address the new conditions. Remember, the UIF has a duty to safeguard the funds of its contributing members for the day when they have to draw down on the fund for ordinary UIF benefits in the case of retrenchments and unemployment. So paying out COVID-19 terrorist benefits has always been something of a balancing act, where we have to look at the affordability versus the need. Meanwhile, the social partners will be engaging at NECA this week to thresh out a plan for income support from the side of the UIF. We believe we would be able to afford to support laid-off workers in sectors which have been closed by government. And I want to emphasize, sectors closed by government, in particular, alcohol industry, over the 14-day lockdown. And remember, when we're talking about the alcohol industry, we're not talking about the whole value chain. We believe that the production is still continuing. On social dialogue and solidarity, let me just close and say, the president has consistently argued for social dialogue as we face our challenges as a nation. We can therefore not overemphasize. We cannot overemphasize the importance of the work of NETLEC in facilitating engagement between the social partners and the united response to the pandemic and the lockdown. This is all more urgent in the face of the state wave. So as we address the issues of health and safety and income support during this third wave, we also keep front of the mind the need to constantly communicate with our people and engage with the social partners to maintain social dialogue and solidarity in the face of threats and challenges that the pandemic brings in its wake. So there's no time for blaming one another. It's time for engagement and look for solutions. Thank you, Minister Nchabe.
Opening remarks, she said we have all the information we need, and therefore you can also pose questions as it relates to the Department of Health, the work of the Department of Health. We have already questions that have been posed on the online platform, and we are going to take some of those questions to get them responded to by the colleagues, and we'll try to also cover the conversations in indigenous language. Just to summarize what the Minister of Employment and Labor was saying in Chivenda, bo thulas nesi bakho amba uri but una chigwada cha vashumi vanofidzi inspector kana vatori vonoko dotora fethu unoshumiwa hone uri uko tevedzerwa na milayo ya COVID-19 uri vashumi musi vachikoya mishumoni vasingokwamewa nga dwadzi hele kana vasingopfukelwa nga dwadzi hele ngori funo humbula zori mishumo aingovhala mara huna ndira ine kushumele kwa dova kukochimbidzwa ngayo. Vadha vatalutshedza uri vurangaphanḓa ha UIF eleno fi unemployment insurance fund vha dzula zwino na dzi actuaries bo dzi actuaries ndi avala vha zwa masheleni vhono kona u vhonela phanḓa uri masheleni a ḓo swika gai uri vha kone u ṱoḓulusa uri huna tshelede iṅwe na yene yanga vha hone uri I kone u thusa havha vhashumi vhono kho ḓo kwamea nga u valiwa ha mishumo zwi tshi kwama nga maanḓesa vha re kha mabindudzi a u rengisa mahalwa na mabindudzi a zwa hospitality kana vha dzi hodela na vha dzi restaurant vhono kho ḓo funa u shuma nga nomboro ṱhukhu vha tshi khou sumbedza uri UIF I na vhuḓifhinduleli ha uri arali vhathu vha tshi khou kwamewa nga u sa tsha vha na mishumo hu funa vha na mbadelo dzine dza vha hone dzine dza itiwa nga dzi company kana nga vhoramabindu vha tshi khou fha vhashumi vhavho and havho dzi company vhavho vhe tshelede kha vha UIF. Vha dovha vha ṱalutshedza uri a si sekthara dzoṱhe dza vhubindudzi dzo valaho, dziṅwe hoṱhe hu khou shumiwa hu tou khou shumiwa nga nḓila yo tsireledzeaho so ri songo vha na nyavhanyavha yori ri khou ṱoḓa unemployment insurance fund I tshi badela hu na dzi sekthara dzi no khou kwamea nga uko kushumele. Ri ḓo humbela na dziṅwe dzi minister dzi tshi amba dzi ḓo ita dzi tshi amba nga dzi ndimi dzavho vhene vha kona u dzi pfha. There are a few questions that we already have, and I'm going to repeat the questions as posed. Jolene van Veek from Media 24 asks, can we get clarity whether livestock auctions may be held? And Nick Wilson from Business Times, Sunday Times, is seeking clarity on whether government will reintroduce TERS payments to those industries that have been shut down now at level 4, and that they've been increasing calls for this. And I was hoping to get clarity on that. I think the Minister of Employment and Labour has already clarified that part. And Nazi from Glow TV is asking, why has international travel not been stopped from hotspot countries like India, or at least impose a 10-day self-isolation period for those traveling from these countries? And some countries like the UAE have also imposed them. As an extra measure, introduced a rapid 4-hour test for travelers. Are we going to do that at our ports of entry? Christian Duplessis from Netwerk 24 has asked, are you allowed to travel through Gauteng without a permit? Can someone from example, the Free State travel without a permit through Gauteng for a holiday in Limpopo? It was clarified that travel is, the travel for leisure is prohibited through Gauteng and to and from Gauteng. It's only travel for essential services and for business. In fact, the primary question is that whether there will be permits to travel to and from Gauteng, because how will people know? That's the question. And Christian also asked the second question: who should carry permits with them when traveling to and from Gauteng? And what is the role of the military in Gauteng? I don't know where the role of the military comes in, because military are in the health. Are they just there to support the healthcare services, or are they there to help implement the restrictions? And government has previously put a lot of money aside to manufacture ventilators. How many have been manufactured, and where are these ventilators now? Maybe let me start with those 5 questions or 8 questions, and then we'll take the next round of questions. We'll start with Minister of Minister of Health on the questions that relate to yourself. Can we have Minister Kubai Ngubane dealing with the questions that relate to health? Thank you.
Can I respond?
We wanted the Minister of Health because they said she was on standby, but if you are ready, you can go ahead, Minister.
Thanks, I didn't hear who you were.
But because you are available, take the questions as they continue to connect the Minister of Health. Minister Dlamini Zuma.
The question, I've been handed a paper with a question about livestock auctions. In livestock auctions are also prohibited just for 2 weeks. Then there's a question on elections that says, considering that an election date has already been announced, has the cabinet discussed how political campaign would be conducted in the midst of the pandemic? I think obviously in the next 2 weeks, there could be no gatherings. They could campaign online, but no gatherings. But it will then be reviewed after 2 weeks. Then we'll know whether the campaigning can go on or not after that. The permits for work in Gauteng will come from the employers. They will be the one that will give permits to those who are going to Gauteng or leaving Gauteng for work, as it has been done before, because this is not the first time there's interprovincial travel limitation. Of course, even those who are going to funerals were permitted before, but they had to get a permit. So it would be the same even now. Thank you.
Thank you, Minister. Minister of Health or Minister Nesi, are you available?
Yes, I'm available.
I'm here as well.
Let's have Minister
Minister.
Kubai. Let's get Minister Kubai to start, and then he'll come to you, and then we'll take the questions for the ministers who are here.
Okay, thank you very much and good morning, colleagues. Thank you, Minister Nchabeni, and to all members of the media. The first one I would like to respond to is that there's been a lot of questions around field hospitals. And you understand in the case of Gauteng, for example, we had NASREC. Firstly is that when the province reported was that they had challenges in terms of you had the hospitals that were there, but there was limited in terms of utilization of the hospitals, and therefore that's why the hospitals were, the field hospitals were no longer used, because you couldn't justify the cost versus the non-use or not 100% use. But currently, in terms of the capacity in the province, more work has been done in terms of addition. We've got the Anglo-Ashanti Hospital activated in the ABT hospitals. We've got Jubilee that has been activated in Tshwane. We've got Bronkhorstspruit that has been activated in Bronkhorstspruit. We've got extension into Barra. So those have been added. What has been a challenge, because we had to reprioritize the beds in terms of repurposing them, but also additional. So each bed needs to have capacity in terms of the human capital, and that is what President announced in terms of the work with Solidarity. But as we continue as well, we continue focusing across the country in terms of our resurgence response with all the provinces. You note that in terms of what Gauteng is doing as well, I'll focus on that again. The Premier did announce during his budget vote additional resources that are going to be provided for Gauteng to be able to recruit. We are monitoring that. There's daily work. We've got what we call a team that is joined in terms of the IMT in the department that works together with all provinces. We are monitoring the beds in Gauteng. We are monitoring the entire country. So there is systems that are in place. I think there's been a bit of confusion in understanding what we do, and sometimes giving an impression that we were not ready as the health sector to be able to deal with this. Where we are seeing pressure more, it's in the private sector. We can confirm that a meeting has happened between the Department of Health in the province with the national team, together with private sector, which we are ensuring that there is an overflow in terms of saying when a patient arrives in a particular hospital and a hospital is looking for a bed, they can go into that facility to deposit to say we are looking for a bed, and then immediately that patient is directed somewhere where there is a bed, and that is updated hourly in terms of the bed capacity. The issue around oxygen, we do not have any challenges in terms of oxygen. Also, that has been activated, where we are working together with the suppliers to ensure that oxygen capacity in terms of the country is available and refilling happens continuously. So those are the questions that has been there, Minister Nchabeni, that has come. If I may utilize this opportunity as well, there's been public comments about us taking a decision that is wrong on terminating the usage of AstraZeneca in the country with the prevalence of Delta. We must remember that with the prevalence of Delta or the growing dominance of Delta in the country does not mean that Beta is no longer existing in the country. So vaccination, that's why the decision was correct at the time, because the efficacy of AstraZeneca against Beta variant was so seen to be very low, and that's why the decision was taken. Now with the Delta presence, does not mean that where we are, we completely, or that Delta has completely replaced Beta in our presence. If you look at all the provinces, you do still find both Alpha in the country, you still find Beta in the country, and Delta. So that's where we are, and we are monitoring others as well in terms of the presence of those other variants in the existing. The rollout plan as well of the vaccine remains intact. Just to explain, somebody saw over the weekend to say the vaccine was not 100 per day, as we said. You'd remember that we do not, mainly in terms of our work of the vaccine, have not activated many of the provinces for vaccination over the weekend. Vaccination currently, in terms of the country, happens Monday to Friday. That's why we were excited about Barra, where it started with the vaccination for Saturday. We've not had the opportunity to vaccinate over weekends, and this is work in progress. Once we have activated more sites for weekends, we'll be able to announce. Limpopo has decided to vaccinate only teachers on Friday and Saturday as a mechanism to ensure efficiency in terms of the vaccine rollout. So I hope as we deal with the matters, we'll continue to clarify, but want to urge listeners and also South Africans to follow what we do, because every week we update in terms of vaccine rollout. And that information is updated as we work. We are working towards a vaccine rollout next week for both the police together with the soldiers. Information has come through to say we are ready to vaccinate the soldiers as well. Thank you very much, Minister Nchabeni.
Before we lose you, Minister Kubai, there is also a question about what are we expecting, what are the numbers we are expecting to admit in hospitals in Gauteng, both in private and public hospitals for this week? And what are the plans to address the load if there is an overload?
Minister Nchabeni?
Hi, we can hear you. We wanted to know, there's a question of saying the private hospitals are already full in Gauteng. What are the plans to manage the load between private and public hospitals? And there's a second question that has just come through around plans to vaccinate for vaccination in prisons for both prison warders and also inmates.
I'm begging to hear, Minister. I just heard that the hospitals in the public sector, the private sector are full.
The question is whether there is a plan to get the private hospitals who are already full to be assisted by the public sector hospitals in Gauteng. And the second question is about plans to vaccinate prison warders and inmates in prisons.
Can you hear me?
Yes, we can hear you.
Minister Nchabeni, I'm hoping you can hear me. In terms of work between private and public, as I said, what we have done is that there is a team that has been activated with the presence in that team. You've got the National Department of Health, you've got the Provincial Department of Health, you also have representative of the major hospitals in the three groups in the country. And one work that we are doing is to monitor to say where there is a hospital, where is a patient that needs hospitalization, that is it's filtered into that team, where then it's looked into and then the placement happens. We have availed, what we know is that the challenge is around the ICU. You find that, for example, where we would have a bed available, let's say, in Bronkhorstspruit, but it might be a general ward, not an ICU bed. That's one of the things that we are now working on to really ramp up to ensure that we can have more capacity, because there is indeed incidences where private hospitals, for example, will have in a group that would send people in the neighboring provinces, because they would be looking not for a general ward, but they would be looking for an ICU bed. I hope I've answered what you're asking, and I've heard the question correctly.
Thank you. We'll have Minister Ngesi responding to the questions that relates to tests.
Thank you. Thank you, Minister Nchabeni. If I heard well, I was able to pick up one question which came from Nick Wilson, which was on whether will the government reintroduce the tax payments to those industries that have been shut down again. I've already indicated, Nick, that the social partners will be engaging at NETLEC this week to thresh out the plan for the income support. And I've said, I do not want to preempt the discussions of NETLEC on this matter, as it will be scheduled to be discussed this week on Thursday. Then we will see what comes out of that. But I must also emphasize, remember there are two types of tests. There's a temporal test, which is meant for this emergency when government has closed certain industries. That's the relief which we normally give. But there's another test which is available when the industry or a particular company is collapsing. That's the permanent test, where we sit with that company, they open their books, and we interrogate everything, and we talk about how to revive that particular company and start talking about the help which they need. So those are two different things. We must not conflate the two. If the company is collapsing because it could not be sustainable, then it means the permanent test must kick in, which will be led by the CCMA. But if it's a temporal closure, we have to talk about this temporal test where we give this allowance we have been giving. Thank you. I'm not sure if there's another question which I've not been able to pick up.
That would be all your questions. I'll now invite Minister Balula to come and deal with the questions around the restrictions of travel from travelers from India, and also whether the vehicle licenses and driver's licenses can be renewed in Gauteng. They want to come and renew driver's licenses in Gauteng and the motor vehicle licenses.
Thank you very much. The measures we have in place require the traveler to produce a negative test taken within 72 hours. We have followed the international protocols, including ICAO, which is the International Civil Aviation Organization rules, which are applicable to all countries. If there is suspicion upon arrival, or the person is not in possession of the certificate, they are required to test or placed under quarantine. The requirement is that they cannot board at the country of origin without valid PCR test. So we all know about this. Who should carry permits with them when traveling to and from Gauteng? Only people traveling for work, medical purposes, funerals, or returning may travel to and from Gauteng. Only travel for leisure is prohibited, and that has been made clear, meaning you cannot come to Gauteng for fun. You can only come here for business and all of that. And if you have been a traveler, you will know what this means in terms of the regulations. So we need to be clearer and clearer about that. We take advice on all health protocols issues from Ministry of Health and the NCCC and relevant health advisors. International airlines and domestic airlines adhere to health protocols. All passengers are screened and advised to wear masks. We have been verily advised that the aviation sector and airlines are not super spreaders. As indicated, various time by the President, we need to balance lives and livelihoods in tackling COVID. People still need to travel for the economy to function. As such, we can't shut down aviation again, but we'll ensure all passengers adhere to protocols. We don't have direct airlines from India. All passengers from India come to South Africa via other countries, and they are subjected to the same regulations I've explained in terms of PCR. So between South Africa and India, there are no airlines. So there's nothing to ban. So I saw people attacking and laughing at Mamloko, the acting Minister of Health, when she explained this. And people ask, why don't you ban airlines to India? We don't have airlines to India from South Africa. That's the truth. If you come from India, you come via other countries to South Africa, and you are subjected to the same regulations I've explained. PCR test upon entry, and then you are also subjected to that PCR test even when you leave South Africa to other countries. And that is what actually applies. So if there were airlines between India and South Africa daily or whatever, then we would have applied our mind to that and respond accordingly. So everyone who comes from India to South Africa come through other countries, meaning you would have come through Europe or Dubai, United Emirates or Qatar, and when arriving in South Africa, you are subjected to the same regulations that we have gazetted, and the regulations we have also the directions that we have approved and which we have not changed till this far. Thank you very much. Nothing about license. I will take license.
The minister says those who are in Gauteng will renew their licenses here, and other people, their licenses must be licensed in their own provinces, their vehicles, and they can renew in their own provinces. Hi lava ku hlamusela uri vanhu va nga te Gauteng swa ku vhaka, unless va ta eGauteng u sala ntirho swa vubindudzi, nako hi ta kombela ti-employer ta n'wina va ni nyika ti-permit ta uri ni tela la swa ntirho ya n'wina, or loko li lava u ta swa business ni fanele ta ni tsale ku na permit ya ni tala la for permit for business ya n'wina. And loko ti-employer ti nyikana ti-permit ta mavun'wa ta vula mhaka uri va ta ku na ntirho la Gauteng ku nga na ntirho ni lava ku vhaka, hi ta va prosecutor because now a wu pfumeli uri ni abuser system. So ha kombela ni tshama kaya ni nga te Gauteng swi nga ri necessary, ha ni kombela. Hi so va minister va swi emphasize, va hlamusela futhi uri a ku na direct flight or a ku na ti-flight ti-aeroplane ta huma la South Africa ti ya India directly or ta huma India ti ta la South Africa directly. So a ku na sorry hi fane hi bena or hi ala vanhu va ku huma India va ta la South Africa, because loko va ta South Africa va hundza in other countries before va fika ka hina. And nako as a country hi tirhisa international standards until hi xanga xa kahle va rini, hi Xitsonga xa kahle va rini. Na hina hi followa nawu wa all other countries va ti followaka ka ku hi tirhisa 72 hours PCR test uri va valid. If nga ri valid a wu ngheni, loko na u khandiya flight a wu khandi if nga u hava PCR test ya ring valid for 72 hours. Na loko u huma la South Africa u famba na PCR test ring valid for 72 hours. 72 hours I think 3 days, yeah. Yeah. Nga Tshivenda va ri kho humbela va singo da Gauteng ara va tshi khou ḓa zwo to dala, kha vha ḓe fhano Gauteng ara vha tshi khou ḓa zwa mushumo kana zwa vhubindudzi. Vha tshi khou ḓa zwa mushumo na zwa vhubindudzi vho kha zwa mushumo mutholi wavho u funa vha ṅwalela permit ya uri vha khou ḓa Gauteng u ḓo ita mushumo ode arali mutholi wavho a ṅwala permit i si yone i songo dzudzanyea a tshi khou zwifha ri ḓo mu fara ra dila naye nga zwa mulayo ngauri u zwifha kana u abuse hetshi tshifhinga zwi vha zwi songo tenda zwi vha zwi khou dzhenisa shango ḽashu kha ngozi arali vha tshi khou ḓa kha zwa vhubindudzi nahone vha funa vha na permit yo no ṅwaliwa nga hanevho no khou ḓo bindudza na vho uri vha khou ḓa zwa u bindudza zwifhio a ri nga tendi vhathu vha tshi abuse system na minister vha khou dovha u ḓivhadza futhi uri a ri na zwifufane kana dzi plane dzo no bva India dzi tshi ḓa South Africa directly dzi fhira kha mashango maṅwe na riṋe South Africa a huna zwifufane zwo no bva fano zwa ya India directly so a huna zwine ra nga ri khou zwi bena kana u thivhela vhathu vho no bva India vha tshi ḓa fhano South Africa fhedzi ngauri vhathu vho no bva India vha tshi ḓa South Africa vha fhira kha maṅwe mashango fhedzi sa shango ri khou tevhela zwoṱhe zwine international community kana maṅwe mashango a khou tevhedza kha mulayo wa u fhufha mashangoni uri muthu a tshi tshimbila u funa u vha a na PCR test yene ya vha valid kana yene ya vha mulayoni for maḓuvha mararu na musi a tshi swika fhano South Africa i funa i kha ḓi vha valid uri ene ha ngo testa positive for Covid-19 na musi a tshi ṱuwa fhano South Africa u funa u ṱuwa a na heyo test yo no sumbedza zwo ri PCR yawe i valid for maḓuvha mararu hayo ene ya vha 72 hours and a huna ono tendela u namela tshifufane kana plane a sina heyo PCR test. We also have the following questions for the Minister of the Police. You have a full load, Minister. The first question, and I'm hoping you are jotting it down, it's a question that deals with the judgment of today. It's from Barry Bedman of ENCA. To say, former president has been ordered to hand himself over to the police station within 5 calendar days, failing which the police must take all necessary steps within 3 days to ensure he is arrested and imprisoned. Considering Zuma's defiance of the rule of law thus far, there is a potential for a standoff at Nkandla. Will you initiate any steps to ensure Zuma hands himself over to the police without incident? What steps, if any, will you take? The second question, on prohibition of the movement in and out of Gauteng for leisure purposes, how do the police plan to enforce this? Are we going to see the same roadblocks on major routes in and out of the province as we saw last year? The third question is from Nazir. There seems to be no will from the SAPS to act against those that are breaking the law concerning COVID-19 restrictions, compared to the enthusiasm of law enforcement officials had in confiscating cigarettes the time it was restricted for sale. Are there any special units formed at each station to act against perpetrators of the violations of the restrictions? The last questions on the ones that we have. They say, Minister, you're a member of Net Joints, and I know, Minister, you're not a member of Net Joints, but the police are members of the Net Joints. They want you, it's Barry Bedman again, who wants you to comment on what is the government's position on the unfolding security situation in Eswatini. Those are the questions you must field, and these are the last questions we are going to, we've got 2 more questions we are going to deal with, and then we wrap up the media interview. Over to you, General.
Thank you. Most of the questions are not part of the regulations, but it's a simple matter. The judgment came about an hour ago and made it very clear that the former president has 5 days to respond to the decision made by the court, and then the instruction is going to the National Commissioner and the Minister of Police to act. That will be 3 days or within 3 days after 5 days have not. So you raise the issue that will defy. I don't have evidence on that for now, but we are instructed by court, and the court, when instruct the law agencies, will have to act, but that matter is not on the table at the present moment. We have 5 days going forward. Indeed, there will be roadblocks. There are roadblocks as we speak, especially here in Gauteng. almost every day, but for sure every weekend, but it will be every day, because everybody that will be getting out of Gauteng or in will have a permit. If you don't have a permit, I don't think anybody will provide the permit of leisure. Surely whoever provides the permit of leisure will be arrested, even before a person who has a permit of leisure arrested. But it's well explained who can or who can't travel, and police will stick to that, implementing the law as the law and regulation says at the present moment. The one question says that we are not acting. We were acting on cigarettes. Well, I can't even remember the story of cigarettes. When was it? But I did give the figures, Minister Chabin, that since we started, we have arrested 465,000 people in South Africa. I don't think those were cigarette people. Those were people that are breaking the law. What has strengthened the hands of the police at this time is that things are not just prohibited, but they have made criminal when you do things that you're not supposed to do. When you gather, when you dance, and when you're not supposed, when you go for the after tears and all that, those things are not just prohibited. Something that has been always prohibited but also criminalized was the mask, but there is broader than that. So that will make things easier for the police. And that will include the people that are mobilizing the gatherings, either political or otherwise. The police will be able now to pursue and arrest especially the organizers and those people that would have broken the law during that time by being there, having no proper distancing, or having no mask. As maybe going back to the point made by Minister of Transport, the drivers will have to make sure that everybody has a mask. But that does not mean that that individual that doesn't have a mask, that get out scot-free, is still an individual responsibility. It's a driver and individual responsibility that you put on your mask. So we'll continue to monitor those things. We'll be on the road. We did meet with the management last week, and we have planned all the operations, how provinces will run the operations, waiting for the announcement of the president and the regulations to come. So indeed, we'll be on the road, we'll be all over to make sure that the regulations are respected. There was a question about soldiers in Gauteng. For now, they are there they go there as a medical corps to assist as they are requested. So for them to be part of patrolling, in terms of patrolling with the police and enforcing the law, there are processes that we need to follow on that one. Starting with the Minister of Police, the Minister of Defense, and going to the President, make the request. That those processes have not started. Therefore, we expect them to be in Gauteng for the medical assistance rather than enforcing the law. For now, police are adequate to deal with those matters going forward. I think I've answered all the questions. Thank you, Minister.
Do we have questions in the House so that we can take those questions? And then we can then get the Minister Kubai and also Minister Nesi to respond to the last round of questions, and I will respond to the general questions that have been sent on both WhatsApp and here. Are the questions in the House so that when we get the ministers, we can get them to respond once? The questions are coming from an online platform. Minister Nesi, there is a question that has been two questions for you that have been sent on the online platform so that you can respond to. And the two questions are: what is the progress that has been made in sifting out ghost employees that employers were using to unduly claim from TES funds, as we saw at the start of the lockdown? And also, secondly, can the minister clarify comments on the UIF being able to fund affected sectors over the next 14 days? Will that be drawn from the TES, or is there a special arrangement? Minister Ngesi?
Can you repeat, Minister, the first question?
Employees that employers were using. Minister, the questions have been shared with you, but the first question is: what progress has been made in sifting out ghost employees that employers were using to unduly claim from the TES in the first round of lockdown?
No, I'm not getting that.
Can you respond to the second question?
What is the second question again? Yeah, struggling.
It's whether the funding that is being considered by the...
I'm struggling. But what I know is that we have improved our systems and much improved them more than they were last year. We are going to be very strict in dealing with those who have to be paid once there's agreement at the level of neglect. That's what I can say at the moment. But I'm not getting you very well, Minister. I'm sorry for this. Or what progress has been made in sifting out the ghost employees that were... No, we have interacted with the Home Affairs. We are interacting with SARS to deal with all those we were able to pick up as per the recommendations of the AG. So there is a lot of the progress which has been made, but we also continue to use the audit firms. We have appointed about 7 of them who are following up the money as we get the people who also have not been able to pay the workers. We are bringing people to book. So it's a process continuing. So we can say it's work under progress in dealing with those, because it's not just ghost workers. It's also the employers who have claimed the money and have also not passed it to the legitimate employees.
Thank you, Minister. May we have Minister Kubai responding to the questions that are related to her sector, which the question is: the initial target for vaccinations were 5 million.
Thank you very much. I think the first one has been around whether we need to, I think the issue. Can you hear Minister Nchabeni?
We can hear you loud and clear.
Thank you. The first one, I think it keeps on coming back, the question of field hospitals. And I need to explain. We currently have what we call alternative building technology facilities that I spoke about, where we're talking about the Bronkhorstspruit, the Jubilee, the Barra, and the Anglo-Ashanti. Those hospitals are doing exactly what your field hospital of Nazareth was doing. Currently, the information I have before me is that they have not been full to capacity. Some of them actually with, for example, if you look at Jubilee, has capacity of 300 beds. And when you look at that 300 beds, the information that I have is that they have never been at 50%. Where we are cognizant of the pressure is in terms of your ICU, your high care, and your emergency units. That's where the pressure is. In terms of general hospital beds, we still are fine. The Emergency, for example, if somebody arrives, they need to be able to check the person to say this is where we're allocating the person to, whether the person gets allocated to go into a COVID section or a green section in terms of normal hospitalization. That's where the cloaking is. And that's what the team has been working on, has been meeting in terms of, especially in the private sector where there's high pressure, especially if you listen to the emergency personnel, if you listen to the high care. But where we can still confirm is that we do not have difficulties in terms of the general wards. We do have capacity in terms of that, and work continues in the work that we are doing. The other issue around the elderly, yes, indeed, we have been upfront to say we had actually wanted to vaccinate about 5 million of senior citizens or 60 plus population from until the end of June. Definitely, as we see it with the numbers that we have, we would not be able to reach that deadline. That's true. And this is, in fact, caused by many factors. The first one around hesitancy. Many people, because of information, and we've shared this, because of information that has been there about the dangers of vaccine and all that, they've been hesitant in terms of vaccinating. So you find that. Secondly, it's the use of technology, as we started with the process, whereby many of the citizens would not be able to vaccinate. And that's why we continue to say an example of Limpopo, because what the MEC of Health in Limpopo had done in the process of this, did what we call coordinated walk-in, where was able to acknowledge that because it's a rural province, people will have difficulties in terms of registering on the EVDS system, and therefore organized in terms of the centers for vaccination to take them into those centers, register them and vaccinate them. And that's why you have 68% of, last time when I checked, and which has increased, I need to verify today's statistics, we're above almost 68% in terms of Limpopo, in terms of vaccination in that province for the 60 plus population. Now, another issue was around all other factors that would link into the vaccine sites where they are, and that's why we announced in our last press briefing that we are ramping up in terms of vaccines, in terms of going them to the people, because currently we have a situation whereby people go to the vaccine, and we announced that our part of our strategy is to review so that we can get the vaccine going to the people. What we are learning in terms of the coordinated work that is being done, where you upfront register, it assists us because we now load data, and teachers, for example, we learn this with the teachers to be able to say we can ramp up in terms of vaccine rollout. So indeed, in terms of the elderly, they have not been closed. As we open the 50 plus population, the 60 plus population continues, and we continue to vaccinate because, as we are saying, there are various issues. And in the last briefing, we did as well indicate that we're encouraging provinces to coordinate, especially the 60 plus populations, those that would have difficulty in accessing the sites, those who have difficulty in ensuring that they register. One of the things in responding was to get the community healthcare workers to move door to door to register the senior citizens to be able to go and register the 60 plus when they go in terms of being able to register and get their vaccines. Again, one of the interventions in responding to the challenges of the 60 plus population was to get the registration to happen in the sites of SASSA, for example, the pay points, to be able to get them to register there. And we are looking into other mechanisms to ensure that the vaccine gets to the population that is intended to, especially the 60 plus population, because we believe they remain the most vulnerable in our communities. The other issue that I'm being asked, that I've received in the WhatsApp in terms of the question, it's around correctional services. Work is underway. We have not finalized the date of the correctional service vaccination. We intended to vaccinate them together with the police and soldiers, as you noted that the president announced for the police. Now we are also by today, I received a report that the soldiers, in terms of vaccination, the process is almost complete. We should be able to start vaccinating them next week. And also we are doing the work. We're hoping by the end of the week, would have indication in terms of correctional services. And the work that we do, just to explain in terms of these categories of frontline and those that are, for example, registered workers, which we'll do even with the sectors in the economy, is that it's easier when you have people who are registered as part of their employment. All we do pre-registration, so they get loaded. That's why you not hear us talking about them registering and then later vaccinating. What we do, we immediately link them to the sites. Their database is taken from their place of employment, let's say the police, from the police. We then translate that database into the EVDS system, which is the vaccination system. Out of that, then we announce a date of vaccination. So what they simply do on the day they go and vaccinate, it's not a process that starts to register. So we're doing that with the soldiers, we're doing that with the correctional services as well, and we're doing that with public service. We're also piloting that with the professional, what we call the sectors, which are productive sectors of our economy. We're doing that as well because this information is available, we're able to translate. And we believe that will also assist us to ramp up our vaccine program, will assist us to move in terms of the numbers that we're looking for. We reiterate that the president has said to us, he wants to see us vaccinating 300,000 per day. We're still sitting just above 100,000 a day. And we think as we move on, we'll continue to do that. And this is also excluding weekends because there's still an issue around the payments of overtime over the weekends for those who will be vaccinating. So that's why for now the vaccination happens between Monday and Friday in most of the provinces, with Limpopo doing weekends for the teachers and also for these professionals, and Gauteng having Bara as a site for Saturday and Sunday. Thank you very much, Minister Ntshavheni.
Thank you, Minister. I want to check if Minister Dlamini Zuma is on standby on the questions of traveling back home, if you were found yourself outside of your home province when the announcement of the lockdown was done.
Thank you very much. I didn't hear the question very well. Can you repeat it for me?
There are actually two questions, Minister. The first question is about those who, when the announcement was made and the effective period of the announcement took effect, they were still outside their home provinces. They want to know what are the arrangements for those who are traveling back home. The second question is from Spelele Dludla. It's relating to the consultation process that was undertaken before the decision to put the country on lockdown. Thank you.
Yeah, you keep breaking, but the consultation that took place, according to the Disaster Management Act, National is the one that has the responsibility to manage. The National Executive has the responsibility to manage the disaster, the state of disaster under Section 27. So the consultation that is expected is with the provinces. So we had consultation with the premiers, with the MECs for COPTA. We had consultation with the metro mayors, with the national chair of the traditional house, and the deputy, and SALGA. Those are the consultations that took place, and with the religious, the faith-based organizations. But according to the Act, there is no expectation for a countrywide consultation. So those are the consultations that took place. In terms of people who were not at home, I think we probably would have to have directions where people can show where their homes are, and to allow the police, if they get stopped in a roadblock, to show that their home is where they are going. So that the police allow them to go home, whether their home is Gauteng or whether their home is somewhere outside Gauteng. Thank you.
Thank you, Minister. There are 4 questions that I will deal with. 3 are from Sipoma Bena of the Citizen on the people selling back pamphlets and street vendors and roadside markets. Do they need permits? In terms of the Businesses Act, they require permits, and those permits are done by the municipality, so it's nothing new. We expect all our traders to follow the law and to have permits from the municipalities. They have been having those permits, they operate with permits. There was also a question around the traders who need to buy stock in Gauteng and selling their wares in GP. The same applies if you are a trader and you want to go and buy stock in Gauteng, because that is business. You produce your permit to show that you are going indeed to buy your stock, and you will show the police if you are on your return trip that you had bought your wares and you travel with your what are called hawkers permits, and they are in line with the Business Act of South Africa of 1991. And does work include services? Yes, work includes services. And there's a question from Richard of My Dopey News that relates to ivermectin they use in the country. SAPRA, which is the Health Product Regulatory Authority, has issued guidance or directions on how ivermectin can be used in the country as it relates to COVID-19. Thank you, and ladies and gentlemen, thank you for your time. It brings us to the end of this briefing, and thank you to the colleagues, the ministers, for availing yourself. Thank you. Keep well and stay safe. Wear your mask properly and wash your hands, and let's avoid public gatherings if they are absolutely unnecessary. And going to public places, we should not go unless it's absolutely necessary. Thank you. Have a lovely day further.
Thank you, Minister.
Thank you.